Hello, welcome to the Victory Podcast. I'm your host, Monique Watson. This is a special series on COVID-19. If you're listening to this, you're probably aware that we're in the midst of a global pandemic. And I wanted to use my professional experience as a public health professional with a master's in public health to engage with other health professionals, both in the arenas of medicine and public health, to talk about this global pandemic. Talking about its impact, the vaccine, what we all can do to keep each other safe. On this episode, I sat down with Saucier Arceneaux of the Louisiana Department of Health, and she talks a bit about her time on the COVID team. She's been with that COVID team since day one, and a little bit about her experience and her thoughts about the pandemic. Let's listen in. Good morning, good afternoon, good evening. Whenever you're listening to this, this is the Victory Podcast, and I'm on with Saucier Arceneaux, who is an epidemiologist from the Louisiana Department of Health, and she's been on the COVID team since day one. Woo. So we'll get into a little bit of talking with her, just to kind of set the scene for our listeners, sort of where we're going to go today. We'll talk with Leslie. She'll introduce herself, a bit about her background, how we know each other. We're really honestly just meeting. So I think we've known each other for all of, let's go with 30 minutes. And then we'll talk a bit about what it's been like for her on the COVID team, what she's seen, how they handled the early days, how are things going today, what are some of the things they're seeing from an epidemiological standpoint, and any other thoughts on COVID-19. So thanks, Leslie, for being on the podcast.
Yeah, of course. I'm happy to be here.
So maybe you can tell the listeners a bit about, how we know each other and some of your professional background.
Sure, yeah. So I was connected through, we have mutual master's degrees, right? From the same alma mater, LSU Health in New Orleans. People typically associated with the med school, but there's a nice school of public health there. And we share the campus. So, anywho, but I graduated with my bachelor's degree at UL Lafayette in biology a short 3 years ago, something like that, 2017, somewhere around that time. And 2 weeks later, I jumped straight into my master's degree in public health in New Orleans. I moved to New Orleans the day of my graduation for my bachelor's degree. The car was packed up. It was crazy.
Wow.
So, but it was a whirlwind, and I honestly wouldn't have it any other way. My master's degree was really, really fun. I was able to I made some fantastic connections during my master's program, which led me to my job now. I did an internship with the Department of Health in their infectious disease section. And I was doing some student work, mostly with enteric disease, which is usually what they need the most help with because that's pretty common, and after my internship, I'd just pop my head in every now and then and just be like, I'm still here. And if you have a paid position, I'll take it.
Take it. So maybe real quick for enteric disease, for those who aren't like you and I in the world of public health and epidemiology, what's an example of some enteric diseases?
Sure, yeah. Most common is salmonella. That's usually what people hear of the most. During the summertime, we get like the good waterborne stuff like Shigella and Giardia, which is a parasite. It's all the things that cause you vomiting, diarrhea, upset stomach, everything the Pepto-Bismol commercial advertises for.
Okay, good. Yeah, I mean, not good for the diseases or the people who get them, but good explanation there on your part.
And so once I got my degree, it was full-time, and the pandemic was not long after. And so I just got kind of baptism by fire, right? That's how this rolls.
For sure. Absolutely. Yeah, so let's talk a bit about that. So you're new in the Department of Department of Health with Louisiana, doing infectious disease, some epidemiology, that is for folks. And next thing you know, this global pandemic arises and sort of what that looks like. So maybe you can kind of tell us about some of the early days. We have, and as this is coming out as part of a series, so you'll hear more from other physicians who were in like the New Jersey area in like April timeframe early on in some of their pandemic response. And there's a similar, very large first wave that happened in the Louisiana, southeastern United States. So maybe you can talk a bit about what that was like.
Yeah, for sure. I feel like it was one of those things where it happened slowly, but then all at once. I think everyone's eyes were overseas for a long time. Ours were, we were in meetings every day with CDC talking about what would happen if it got here. And then the first case in the US happened, and I think we were a little shell shocked. I think everyone was. And so we started the day we found out that Louisiana was going to be able to start testing at our state lab, was kind of a blessing and a curse, because we knew it was like, okay, this is it. This is when this gets crazy. Like, so it's going to be a little wild from here on out, and it was. As soon as we were able to run a COVID test, the phones were ringing off the hook. I don't think we had 3 on-call phones that would roll over to each other at one point. Just because, I mean, if I would answer the phone, I'd miss 10 in the process. And it was just,
wow.
It was kind of, yeah, it was madness for a while. But I don't think anyone, even in school, in experience, can prepare for this. I really don't, but I think I'm extremely lucky to have been on a team with such fantastic people. I think our health department is very unique in the fact that it's very centralized. In a lot of other states, it's not that way. So we were a very tight-knit group, and I think that is what has helped us take this on and respond so well and so quickly.
Yeah, absolutely. So in your in your role, I was looking and trying to do a little bit of research on my end. So you're over kind of Region 6 for at least in a general sense. What sort of areas is that cover a good chunk of? Is that more New Orleans centric, or like Lafayette centric, or Shreveport, or is that cover maybe a little bit of everything?
So the state's broken into 9 health regions. Region 6 encompasses 8 parishes in the state, and I oversee those 8 parishes, and I'm what you would call central Louisiana, so kind of just that very middle, the belt, if you will. New Orleans and Baton Rouge are regions 1 and 2. That gives you any idea of kind of, it's a little mixed matched and broken up in a weird way, but it's supposed to kind of be give an equal workload to people who are assigned to the regions, based on population and whatnot. But yeah, I'm central Louisiana. I cover 8 regions, one of which is my home parish, born and raised in Voiles. So that's been fun. Getting back to my roots and giving back that way has been very rewarding.
Nice. So yeah, I imagine, from afar, so just for context for myself, I'm a native. I consider myself a native, born in Virginia, but grew up my formative years in New Orleans. So from Louisiana, even though I don't sound like it, which is what I get all the time when I go home, until I throw a y'all out there, and then I get to pass through. That's my passport. But being out in the Bay Area,
That's
we
right.
kind of hear, being out in the Bay Area, we sort of hear things, of course, more on the national news circuit. So we talked and sort of try to keep in the loop just of where all different regions are doing in general. So how do you think, at least you could probably speak more specifically to the region you're over, but how do you think Region 6 or Louisiana as a whole has responded? And I'm not so much, maybe a mixture of from you all's side, but even of the way people are responding or receiving the different phases and and activities that are put in place in order to try and flatten the curve.
Right. I think in the beginning, there was so much unknown from everyone's standpoint, right? I mean, even us. It was, coming up with guidance was more or less, okay, what do we know about flu and general coronavirus? And let's meld those two things together for infection control. And that's our guidance for now. Because I think we've been kind of spoiled in a sense as a general population. We've never had to wait on science before, really. I mean, truly, none of our generations have really seen that, none of us have had to wait for an antibiotic to be created or wait for a vaccine to be created. I mean, the majority of us grew up and those things already existed, and that level of understanding in science was already established. So people don't understand that took decades. And so now we have this new virus, and it's still going to take decades. We have a lot of technological advances, and research is, leaps and bounds to what it was 60 years ago. But at the end of the day, science takes time. And I think that was the hardest thing to get across, and still is. That is definitely still a huge obstacle, is people want answers right now, right now, right now. But for me to feel confident in what I'm telling you, it is going to take time. Mm-hmm. So I think that's been the biggest obstacle from the beginning. There's also has always been a lack of trust between government and community, especially I find in Louisiana, where the majority of our communities are made up of rural communities. So it's just like that extra barrier, that extra gap, asking them to, stay home from their job and not work. Don't go see your loved one in the nursing home. Don't, this is all coming from the government, who they already don't trust. And now we're dictating, in a sense, what they're doing with our daily life. And, so it's just like almost creates the chasm gets bigger, right? So it's trying to find those small connections and build trust in a community. And that's really where our efforts have been focused, I find, over the last few months. I think, it was a big advantage that I'm able to oversee a region that I grew up in, because I don't know that I would have a strong of a foothold in the community if people didn't already know me. If they couldn't, if whenever they asked me the question, "Who's your grandfather?" and they didn't know him, I feel like
I don't know about this Leslie girl.
Yeah, exactly.
I don't know the people. Just to give context for people across the world, Louisiana as a whole, whether you're in the middle of Louisiana, New Orleans, Shreveport, any parts of the boot, is very family-oriented people. A lot of people never leave Louisiana. A lot of people have never really traveled very far outside of the Southeast region. And it's all about, like, you could go to MIT, Harvard, Stanford, whatever. You get home, I come home. It's all about what high school did you go to? It's all about, who's your mama and them. And that's literal phrases that you will hear. And I can't even do a Central Louisiana accent justice at any way, shape, or form. But it's all about this sense of community. So I definitely appreciate and want to try and give context for people from other parts of the country, because it's definitely not necessarily, it's a different challenge. I think I'm not in the public health department, but I work in kind of occupational health in out here on the West Coast. So you kind of see some of the public sentiments, but it's a lot of me, I, because people are from all over the world, really. And so you have all these different cultural clashes that sort of happen. And this, I think, less of that challenge is it's definitely challenging, but definitely some of that you still see, though, with that lack of trust and the sort of, you can kind of look at that science and waiting on science. I kind of get excited by it as a scientist, right? Because we're on the cutting edge of information in a way that's like never been in a world of public health in a way that information is now being shared with people because of the technology that exists. But then also people are actually very curious, at least that I've seen, and maybe you have a different perspective, because they're very curious and starting to learn things about science, like how are vaccines made? How does diseases transfer? Why is it so important? Like, people are actually starting to wash their hands properly after
Absolutely
decades of, we've been talking about washing hands in the world of public health education for probably literally a century now, if not longer. And now it's kind of an aha.
We all have that poster from middle school of the how to wash your hands, like embedded into our brain, like whenever, it's there for sure. No, it has been, I have to remember, just in the madness of all this, I often have to just take a step back and remember that this is history. Like, everything that has happened this year is going in a history book. And one of those moments was this week. I got the text yesterday afternoon that my first healthcare worker in Region 6 was vaccinated. And I just I turned off all my phones. I shut my computer, and I was just like, wow,
It's light speed. Yeah, it's crazy.
It is. Yeah. So it's really, it's humbling, honestly, to watch the work that the public health sector has done in this last year. And to know that I am just like some minute fraction of it makes me so proud of myself. And I hate to, make it about me, but because I have a team of people who are just absolutely incredible that I work with every day. And I would not have been able to do this without, it's been a whirlwind, but I have learned so much, and just about everything, about epidemiology, about the workforce here in Louisiana, about what it really means, like, to be a community and to come together to support each other. There's been so many lessons out of this, and I know it has been a hard year for everybody, but there have been so many takeaways that are positive for me from this year that it's hard for me to focus on the negative.
Yeah. What would you say you're like, I don't know, and this is a little bit more putting you on the spot, so feel free to take some time to pause and think. So you mentioned the positive takeaways. What would you say, like, top 3 takeaways that so far in this, what have we been at this since March? So 9 going on 10 months of this whirlwind that is a global pandemic, would you say?
Yeah. Let me think. Okay. So first of all, I definitely think the biggest thing, professionally for me, was I learned that I had to trust my gut, that I went to school for 6 years for a reason. I was given a master's degree for a reason. I have work experience that contributes to this expertise and this position I'm given for a reason. And this pandemic has forced me to trust my gut. And I realized that I'm actually pretty good at my job. And so is everyone else around me, And I really don't think that I would feel that way if this had not happened. And so I am eternally grateful for that, because this pandemic has pushed me as a public health professional to just run with it. Just go, trust yourself, trust what you've been taught, and always just like knowing that I was doing the right thing. And it just all worked out. It does. And to this day, if I ever, if I'm feeling pressured in a situation and I cave in, it always backfires. Mm-hmm. I'll get a call about and so trusting my gut, that was number 1. Number 2, I'm a very, I work a lot. Even before Corona, I'm a very work-oriented person. It's just in my nature. I get that from my father for sure. Just a workaholic. And this pandemic has forced me in my personal life to learn to separate personal and work, and that there has to be a line for mental health reasons, you know? And so that, I think I needed to be pushed in that way to get there for myself personally. So that's also been another good thing. I don't know about the third one. That's hard.
Yeah, two is good. Those are two good ones. So, yeah, I tell you, I hear you on the trust your gut, and it's been an interesting dynamic. So you're working more in the governmental public health sector. I essentially take what people and similar folks like yourself send down informationally and say, okay, so how does that apply to our work site, and how do we best implement those activities, using my both hats of realizing the business case, but more the bigger hat being as a public health professional. Even though I'm working in industry, it's still that auspice. So I've had where with the masking changes and wear a mask, don't wear a mask, what masks are available, what can we have access to? Are we considered critical infrastructure as our state, California, defines it? We have things like a current travel mandate in effect in the county of Santa Clara, which, just for context, you were mentioning parishes, counties, parishes, the same. Every other state calls them counties, but in Louisiana it would be a parish. So yeah, it's been a challenge just because, like you said, but yeah, we're living history and we're at the forefront of science and information, and it's literally new information is coming out day to day, whether it be on the disease itself, the long-term effects, as we're starting to learn more of post-COVID, long COVID. And so we'll be talking about this, and you'll probably be writing papers on this and things for 10 years to come. So our challenge has been, we have, especially as large as California and even more specifically the Bay Area is, people commute from all over, and each county, the Bay Area has tried to be aligned as best stable, but then some don't. And so it's sort of like, okay, but I live in this other county and they say I can do X, Y, and Z, and this other county says I can, and it's like a whole thing. So anywho.
Yeah. For sure.
For sure.
We have I think what's been very difficult, not just like guidance varying from different county to county, but also just how much the guidance has changed so rapidly. I feel like I get the community used to one set of things and everyone understands, and I educate everyone. And then the very next day I find out that something's different and I feel like I have to backtrack. So that has happened on so many occasions during this pandemic,
Mm-hmm. For sure. Because the CDC and the information is coming out hot off the press. It's like, I know that we said, only N95s will really protect you, which is true. It's not untrue. It's just like there is some level of protection that exists in cloth masks now. Some of the research is saying there's some mild protective effect. So stuff like that, we're like, oh, but then before, it's like, look, I can only tell you as the information comes out. I cannot predict what the information will be. So it's challenging.
Yeah, exactly. It is very challenging. And then also, this information's coming out, and I also have been trying to get people to understand that there's also, a kind of a stark contrast or difference between medicine and public health. And so, they're like, well, I wore my cloth mask, so I'm not exposed. And it's like, their doctor would be like, yeah, you're probably right. And then, but from a public health standpoint, I'm like, yeah, but the study said that it provides some protection, but I don't know if it's 100%. Enough to get you quarantine. And I don't know, so it's like trying to differentiate between that as well. And so I can't, I've been just trying to keep an open mind and just be so vigilant and understanding that this all makes so much sense to me because I live in it. But I can't imagine what this looks like from like I want to say my dad's point of view, who's an electrician who just watches the news at night, and how that must feel. And it must be just so confusing and look like we kind of don't know what we're doing, honestly.
Yeah. And I try to, it's funny because for example, our facilities teams, we sort of have those conversations. They're like, which is it and what's going on? And it's like, I understand the frustration, and you have to kind of like turn on your empathy button and just really be like, I understand it could be frustrating and confusing and all that. So yeah, it's a challenge, if nothing else, man, I tell you. So as we're wrapping up, because I don't want to delay you long, I know you're 2 hours ahead of me, and it's probably close to dinner time, and I'm sure your spouse is ready to murder you if you stay on for much longer. So maybe for like a closing thoughts on COVID, and maybe if you had two things to tell the world about, what can they do to kind of prevent transmission or trying to catching this disease, catching this this pandemic virus. So
Yeah. First, I would say trust the process. We've hit on it multiple times in this podcast that we're making history, and y'all have to, the public has to remember that you are seeing things come out as quickly as we are. So the day you see it on the news is the day I saw it on the news. I didn't get it 2 weeks ago, and you're the ones just finding out about it. So, I mean, y'all are getting things as fast as we are, and it takes time to digest. And so trust the process and trust that all of the recommendations are truly, it may not seem like we're trying to push in a direction to get back to normal, but that's actually exactly what we're doing. I'm just number two, I'm gonna preach what we've been preaching since March. Wear the mask, wash the hands, socially distance.
No, I definitely agree with those 2 points. For sure, we all have to do this together. And the faster and more kind of compliant, so to say, we are with those things, is the faster and more, the sooner we'll get to back to a new normal. So, well, thank you so much, Leslie, for spending some time with me, fighting through the technological challenges we had this evening.
Yeah, no problem.
Thank you for your service. I feel like I was on with Dr. Bent, one of the other folks you'll hear on this series, and she says, this whole working, she was doing some ICU stuff and all this kind of stuff early on in April. It's like a war zone, right? We're all kind of off the cuff, responding, trusting our gut, like you said, and you just wake up and it's like, okay, what is it today, and are we ready, and how are we going to adapt?
That's exactly it, and so I don't know, I'm sure you remember I don't know how different our programs had changed from when you got your master's and when I got mine, but on every Friday we had those, what we came to call them as in the bush talks. It was all these people who were out there who would come and talk about their experiences of working in epidemiology and public health in just dire situations. And, one of which was someone from Louisiana, a doctor from Louisiana who had worked on the Ebola response in Africa, and he was just like, you ball up and throw away everything you learned in school, and you pretty much start from scratch. And that was definitely how this felt. I definitely relied on some of the basic epi principles at the beginning of this, but you just kind of have to throw away whatever sense of normalcy or regular public health response that you think and you start over. So yeah, it is definitely a war zone and just new territory all around.
Absolutely. All righty. Thank you so much for your time. Thank you for coming on the podcast. Continue the great work you're doing there. And
well, thank you for having me. I appreciate it.
Oh, absolutely. Absolutely. Thanks again to Leslie Arceneaux for sitting down with us here at the Victory Podcast. Really insightful and really good information there that she shared. As always, please share this podcast with your friends, your family, and even your enemies. We are on all your favorite podcasting tools. So the easiest way to find our podcast is go to our website at thevictorypodcast.com and visit the Where to Listen page. There you can link directly to your favorite podcast platform to find this podcast and share it with others. You can also support the Victory Podcast in 2 ways. You can join our Patreon at the various Patreon levels. There you get access to exclusive content, early content, as well as other great little goodies. Also, you can buy some Victory Podcast merchandise. We have t-shirts and stickers, all kinds of great knickknacks for you and your family to share. And that's a way you can support the Victory Podcast. I'll end this episode as I do every episode. Every problem has a solution. It's whether you're willing to do the work to find it. Let's do the work and be victorious.